Hi guys and welcome to Tiny Evils. Now we are going to start with the last type of systemic mycosis, that is Paracoccidiodomycosis. Now this Paracoccidiodomycosis is also known as South American blastomycosis or Lutz mycosis. Now this is caused by again a thermally dimorphic fungi, Paracoccidioids brasiliensis. Right, and do not go on its name. It is blastomycosis, but not caused by blastomyces dermatitis. That was causing coccidioidomycosis. Right. So a little bit about the epidemiology as well. This will help you remember the name as well, the name itself. Right. That it is endemic in parts of Brazil and some other South American countries. Hence the name. Right. So, as this is a systemic mycosis, you know that most of the time in the immunocompetent people, this infection is going to be asymptomatic. Our immune system is going to take care of it. But in the disseminated infection is going to be seen in immunocompromised people, such as HIV infected people. Right. So let's talk about the pathogenesis, and it is going to be the same story like we have heard so many times. Right. The mode of infection is going to be inhalation of spores of the fungi, right? And then these spores are going to go in our lungs, and finally eventually they will develop into their yeast form. So the yeast form is going to be seen in lungs. Now we are going to talk about two major forms of paracoccidioidomycosis that are seen, right? So we have acute form and chronic form, right? We have two major forms, acute and chronic. So this acute form is less commonly seen, and but it is the more severe one, right? So it is going to cause more damage. So this is less common but more severe, right? It is going to involve various organ system, various viscera of your body, and it is going to be a disseminated infection, right? And this is seen normally in young adults less than 30 years of age, right? And this is going to be a disseminated infection which is going to involve many of your viscera. Right. Now, when we talk about chronic form of paracoccidioidomycosis, it is more common. About 90% of the cases are chronic forms only, right? And it is less severe as well. Okay, and it is seen in older men. And what you are actually going to see is this disease will manifest as a progressive pulmonary disease, right? It will be manifesting as progressive pulmonary disease, and mostly it will affect your lower lobe of the lungs, okay? And there will be presence of fibrosis. Besides this progressive pulmonary disease, what other clinical features you can see? There will be presence of some skin lesions, some oral mucosal lesions, and in some cases cervical lymph nodes may be enlarged in size, right? Lymphadenopathy. Now let's talk about the lab diagnosis. Right, so what all samples you're going to collect if a patient is suspected to have paracoccidioidomycosis based on the geographical location, right? So you can collect bronchoalveolar lavage, the sputum, right, or biopsy specimen. This is bronchoalveolar lavage, right? Then what you are going to do is you are going to stain it, the histopathological examination, and on histopathological examination you are going to see a very peculiar appearance which is known as captain's or the pilot's wheels appearance, right? So in this image what you are going to see is this is what we are calling as pilot wheel appearance. Now what actually is this pilot wheel appearance? This is actually a multiple budding yeast cell. This is a parent cell जिससे a lot of buds are coming out. So this is appearing like a pilot wheels appearance, right? And in some cases you are going to see just two buds coming out of the parent yeast cell, right? So this is your Mickey Mouse clubhouse. This is the appearance we are talking about, right? So this is the single parent cell yeast cell which is giving out two buds. So on histopathological examination, that is at 37 degrees Celsius, obviously you're going to see the yeast form because it's a thermally dimorphic fungi. So these thermally dimorphic fungi in their yeast form show multiple budding yeast cells, okay? Multiple budding yeast cells, which are giving this pilot wheels appearance or Mickey Mouse appearance. It is really called that, Mickey Mouse appearance. Right. Now, what else you can do? You can do obviously culture. So at 25 degrees Celsius, you're going to see the hyphal form. So you are going to see hyaline septate hyphae with chlamydospores. And these chlamydospores are nothing but the asexual spores of the fungi. Right. So in this picture, you can see these are the septate hyphae, and these all are the chlamydospores. Right. And then what else you can do? You can do serology, antibody detection. Right. So we can do antibody detection by immunodiffusion test. And in some cases, now ELISA is also done, and the target antigen in here is glycoprotein 43 antigen. Okay, this is the antigen of the fungi that we are targeting in case of serology. Now, how are you going to treat the patient? Obviously, for the treatment, you are going to give itraconazole, right? That is the antifungal that we've been seeing this whole time. So itraconazole is given in normal infections, but if it is a disseminated infection in HIV patients, we can give amphotericin B. So let's recap what we have learned about paracoccidiodomycosis. So this paracoccidiodomycosis, also known as South American blastomycosis or Lutz mycosis, is caused by the fungus Paracoccidioides brasilensis, right? And it is endemic in some parts of Brazil and some other South American countries. And the infection is going to be asymptomatic normally in immunocompetent people, but the disseminated form can be seen in patients who are immunocompromised. Now, the pathogenesis, there will be inhalation of the spores, which will be converted into the yeast form. And two major forms of paracoccidioidomycosis is seen, the acute and the chronic one. Acute one is less common but more severe. The chronic one is more common but less severe. Right, and acute form is seen in young adults less than 30 years of age, while the chronic form is seen in older men. Right, and acute form will be a disseminated infection. It will be involving a lot of your visceral organs, right, while the chronic form will manifest as a progressive pulmonary disease involving your lower lobe, and there will be presence of fibrosis. Some other skin, oral mucosal lesions and cervical lymphadenopathy can also be seen in this infection. Now, for the lab diagnosis, you're going to collect specimen, which will be bronchoalveolar lavage or sputum or biopsy specimen. Then you're going to stain it. On staining, on histopathological examination, you're going to see multiple budding yeast cells, right, which will be giving the appearance of pilot wheel appearance, right? And in some cases, there will be just two buds coming out of the yeast cell, right, like here, just two buds, which is known as Mickey Mouse appearance. They should call it Minnie Mouse appearance because it is very small. But anyways, now what else you can do? Culture, right? So at 25 degrees Celsius, you're going to see hyaline septate hyphae with chlamydiospores, and on serology, you can do the detection of the antigen GP43 produced by the fungus, right, by immunodiffusion test or ELISA. And for the treatment, you are giving itraconazole in normal infection and amphotericin B in disseminated infection. So that was about the paracoccidioidomycosis. I hope you like this video. Thank you.